Hi, this is Pam Worth, and today from the Hello Health podcast, I have Eileen Kopsaftis, and she's a pain consultant, movement expert, and nutrition educator dedicated to helping people live pain-free and age without decline, which is a big, big statement. Over 30 years of experience, and we can't wait to learn more. Thank you, Eileen, for being here.
Oh, thank you for having me. I'm very excited and hoping that we can help a lot of people with some information that's not mainstream, but it should be. So,
Yeah, so tell us how you got into this journey and where you kind of like to step into it. I know I shared a little bit about a number of different family members, but I think everybody deals with pain, all ages, and all reasons why. So I'll let you kind of take us through this journey.
well, when I was very little, I wanted to be a doctor. And then when I got old enough, I realized I didn't want to follow the medical model. I've got nothing against doctors. I just didn't want to do the medical model. I wanted to spend time with people and I wanted to really be able to make a difference in their lives. And so I was going to do nutrition and become a registered dietitian. And then I realized, because this was back, when the dinosaurs were roaming the earth, they were still teaching the four food groups and things that I didn't agree with. And I thought, I'm going to disagree with everything they're teaching. So they're probably going to fail me. That might not be good. And so then I saw their physical therapy program, and I've always been fascinated by the human body. And I knew I'd be able to spend time with people face to face and really make a difference. So I went into that. And then the interesting thing is, and I mean no disrespect to my profession, but there are a lot of clinics out there that do what I call the cattle prodding, where they just herd them in and herd them out. And the people do not get the one on one care that they need. And those therapists get so burned out. They usually hire new grads and they get so burned out because they can't really help anyone. It's terrible. It shouldn't even be legal. But I was really blessed to have a speaker come in my senior year in class, and she talked about manual therapy and skills and how, I mean, she had a 3 week waiting list because she was so good at helping people get out of pain. And so I contacted her when I graduated, and she became my mentor and good friend. And we traveled everywhere, taking as much coursework as possible. I asked her to steer me away from things that would waste my time and resources and aim me at things that would actually help people. And so for the first 15 years of my profession, it was all about learning everything I could to put my hands on people and fix their pain. And then the last 15 years, I was introduced to a movement method. It's a three-plane movement training by the Gray Institute that to me was the holy grail of movement. Because as a PT, if somebody's got knee pain and you're just teaching them to straighten their knee, or you're just working the knee, but it's not the knee, and I learned this as a manual skilled therapist, that the pain or the problem is often not where the pain is experienced. So, but movement never addressed that. Movement was always aimed at the part that hurt, and it made no sense to me. So when I learned this through the Gray Institute, I was, oh my gosh, I was thrilled. It was like a Christmas present. And I took every coursework they had. I've taken their advanced stuff, which is kind of like a PhD in biomechanics. It'll make your head hurt. It's like 250 hours, 40 weeks. But I learned so much about the connection of the human body and how the ankle can impact knee and hip and shoulder and neck. And I can't tell you how many people I've helped by treating a body part that's nowhere near where their pain is. But because of my training, I've become, and I don't need to put my hands on them. So I started teaching classes at the local community college. I have online programs. I've got a YouTube channel. I want everybody to know how to train their body so they can shut down the pain. And it's very effective, and I absolutely love it. So I'm kind of living my best life at this point.
So for someone like me that has chronic ankle pain and they're suggesting surgery, and I've tried so many things over the last 20 odd years, what would
Mm.
you suggest for something like that?
Well, I try not to suggest specifics for people that I haven't assessed and I don't know their history, because I could cause more harm than good. I
That's
could recommend something to you that could actually hurt you because I don't know why they're telling you you need surgery. And I'm not asking you to give me your medical history right now. Is it a ligamentous issue? Is it a tendinous issue? Is it a bony prominence issue? I mean, what's going on? Why is it not functioning properly? But I can tell you that what I teach, a lot of people are not teaching. So the ankle, it does have to move in all three planes of motion. I got my little favorite thing here, but you've got a bone here called the talus, and it has no tendons attached to it. And it's completely dependent on the heel bone below doing the right thing, and then the bone above doing the right thing during gait between heel strike. and toe off. And if it's not doing the correct thing, it throws off the mechanics of the entire body. And most people are not training the ankle in three planes of motion, focused on restoring, especially something called eversion inversion, which is just side movement of the heel. And then the pronation supination, which is rotation of the foot and ankle as you walk. So there's a lot of training that you could try. I am emphatic about the fact that nothing should hurt repetitively. I give lots of modifications. So in other words, well, if you go to do this movement and it bothers you, try turning your foot out or try going wider. So I give lots of modifications and I make sure that nobody's doing anything that hurts in repetition because you're just, punching the bear in the nose, or your brain is telling you, okay, I'm going to have to protect you because you're hurting yourself. And so you'll start compensating. You'll do all these weird, funky little movements trying to make it stop hurt. And now you're training in dysfunction. So, yeah. So you could try things on my YouTube channel, where I have a free three-plane assessment in my private club. It's a 23-minute video that walks you through how to assess your body in all three planes. And you can see, oh my gosh, yeah, I'm not good in this motion or I'm not good in that motion. And then you kind of have a better idea of how to focus your training.
You, at what point do you want people to reach out to you? At what point in their pain journey?
Yeah.
Or do you want them to do an assessment first and then call you, or do you want to do the assessment with them? Kind of talk to us about what you kind of prefer for people as they're kind of thinking.
Yeah. So, well, when it comes to private consulting, I don't do much of it because there's only so many hours in the day. So I do prefer that people have tried something on their own through my training. A lot of it's free, so I'm not expecting them to buy something. But but it, I think if they're very limited, like if they look at that three-plane assessment and they're like, man, I can't even get close to doing those movements. And they're not, big, horrible movements. You don't have to be like an Olympic gymnast or anything to do them. But if they're so limited that they can't like lift both arms up at the same time without pain, or they can't take a step forward without pain, then that would be the time to reach out to me so that I can modify things extremely and just get them started. So, yeah.
And what other sort of changes or habits or things do you recommend for people as they're going through some of these?
Mm. So, well, I kind of, I've got two populations that come to me for content and training about, and I did a survey years ago, and it was almost 50-50. It was almost exact. Half the people come to me because they want to get out of pain. The other half come to me because they don't want to end up in a nursing home. And so I have found that it really depends on what their focus is. But most people, when they work on the pain and they get better, then they realize, oh, I want to age well too. So then they kind of transition into the other population. But the most important thing is I've got what I call my pillars, 7 pillars of lifelong well-being. And it's important to address those if you really want to age really well and not end up losing your independence or having to wear disposable underwear or all the things that we think are required as we get older, which is not true. And so, the first pillar is mindset, because if we really believe that we're supposed to decline as we get older, what happens is that colors our choices and our decisions, because we think there's no choice. So we don't do things that we could do that would help us. And we do things that we probably shouldn't do that don't help us. But it's because we think it doesn't matter what we do. So that's huge. You've got to change mindset. And that's the first chapter in my book, Aging Culprits. And then the second pillar is movement. We have to move. And so many people are afraid of movement because it hurts, or they get tired easy, or they don't know what to do. They've injured themselves because they've decided to, okay, I'm going to just get started. And then they do more than they should, or they're doing movements that isolate muscles and actually cause more harm than good. And so I have lots of, easy movement things on me, like just a simple hip matrix of hips going back and forth and side to side and turning. Just that simple activity, I've had people report to me it's relieved their pain. So we've got to move. You know, motion is lotion. We're designed to move. And the more we don't move, the worse we get. So movement is key. And then the third one is nutrition, food. It's very important that we're nourishing our body in a healthy way and we're not living in fast food drive-through lanes and all those other things. And then hydration. A lot of people are not drinking enough water. A lot of older people literally struggle to gain strength if they're exercising because they're not drinking enough water. Muscles require hydration. They're like 78% water. And you hear from the older population, and I've worked in pretty much every population there is, home care and nursing home and orthopedic and acute hospital. But you always get the same answer, oh, but it makes me have to go to the bathroom. And I say, well, that's kind of how it works. Water in, water out. You know, but but it's important that we're well hydrated. Dehydration will make you tired. It will make your muscles actually go into spasm and cause pain because they're crying out for water. So it's huge. And then sorry, no, and then there's community. Community is key. If you have everyone around you saying the opposite of what you have found to be true, so if you've decided, okay, I've looked at this, I've seen enough content, I know that I don't have to decline. I know I have a choice. I can work toward this. And I have people in my Have Lifelong Wellbeing Academy who are in their average age is 50 plus, but a lot of them in their 60s, 70s, some in their 80s, and they have learned how to train their body and they're not declining. I've had so many people like in their 70s tell me I was hiking and I was so stable. There were so many times I know I would have fallen had I not gotten stronger through this program. So it's huge and they see the difference. But if everybody around you is telling you, oh, you know, you are getting older. What do you expect at your age? Of course, you're supposed to have pain. Why aren't you on all those medications? My dad was 93 and the doctors thought he had Alzheimer's because he wasn't on any medications. And I had to tell them, no, he's not demented. He's right. You know, so it is possible. And but there's that. And then expert guidance. There's so much stuff on the internet that, you know, cure your back pain with this one move, or all these little gadgets and gizmos and programs. And I don't mean any disrespect to anybody, but a lot of them really don't know what they're doing. They're teaching things that could really harm people because they're not providing modifications like, and everybody's very familiar with yoga, right? So if you go to a yoga class with a really good yoga teacher, she's providing modifications to her class. She's making sure they do things correctly and they're not hurting themselves. And then you go to a yoga class where none of that happens and people get injured. It's not the yoga that did it, it's the skill of the teacher. And so you want an expert teacher, especially if you've got chronic issues that you know you need to address.
For sure.
And then,
What are some of the resources that you really like to trust? I mean, it's hard to get through the noise.
yes, yes. So well, I do a lot of clinical research. So I go on to like PubMed and all those places.
Mhm.
There was a research organization that was the most trustworthy in the world, and I won't name names, but they started taking money from organizations. And one of the men that founded it, well, I guess I will name names because it's well known, the Cochrane organization. They were the most trustworthy research organization on the world. And if you found a study in the Cochrane, you knew it was true. You didn't have to worry about the integrity or the honesty behind the study. And Dr. Peter Gertschke, who was one of the founders, questioned them because they put out an article that he found was less than high integrity. And I don't know the details of the article. I did actually speak with him. We were speakers at the same conference one time, but he said that he questioned it and he found out that they were taking funding, and he really was very upset. They ejected him from the organization because he questioned them, and he was a founder. So, you know, prior to that year, which I think was maybe 8 years ago, Everything is very high integrity on that resource. So it is hard. I mean, I've got graduate level biostatistics in my background because I have a nutrition educator diploma, but not everybody has that. So you look at a clinical study and you don't know how to look at the numbers and know are they playing with it or are they not. But I will give a little hint for everybody. So if you read an article or a study and it says relative risk reduction, they've played with the numbers and they're lying to you. If you see the word relative, if you see the word absolute risk reduction, it's the truth. So just look for those two words because relative, they play with it. Well, if it's half, then, if it's 1 out of 2, then it's 50%. It's like, no, but they really, yeah, they play with the numbers. It's not real math. Let's put it that way. So,
Now, I think, and I mean, I don't know this, but I would imagine we're going to attract a lot of potential caregivers to listen to this. Um, when you're speaking with caregivers, they have the difficult job of convincing the person on the other side that this is a good idea. Any
yes.
suggestions or thoughts for them?
Yes. Well, what I have found, and like I said, I've worked in settings where we had a lot of people who had lower cognitive levels of ability. And what I found is a lot of the times, I remember one home care patient, it was like, even though she didn't remember me from one visit to the next, she had no idea who I was the next time I showed up. But it was like her body remembered the movements. It was sort of like muscle memory. So when I started demonstrating and helping her, like lifting her leg to show her what I wanted her to do, she just started doing it. It was like her body kind of memorized the movements, which I thought was pretty cool. So you might find that it's not that bad. I've also found that if you're doing an activity, they kind of want to mimic you, which is good. So doing the movements yourself is always good. Obviously, making sure that you're very safe is key. I've taught many people how to transfer someone safely without injuring themselves. I mean, there's a lot that goes with it, depending on the level of care that the person needs. But it's surprising. I've seen many people with a lot of stuff going on, able to do things. Not perfectly, not all of it, but able to.
Fabulous. Anything else I have forgotten to ask about or you want to touch on or how people can find out more information?
Well, I do have my main website, which is havelifelongwellbeing.com. And that has a 5 question quiz, which literally takes like 2 minutes to answer. And it will aim them at any of the content I have on the topic that they are most concerned about. So they don't have to search around for, okay, where is this and where is that? Just answer those questions and it'll provide for you a page that has links to all the content on that specific issue that is your concern.
Thank you so much. We really appreciate you being on today.
Thank you.